Don't record it. Wait. Where are you listening from? We are live on Zoom as well for anyone who wants to join on TikTok. So, caring for your older parents. If you want to drop in the chat box where you're joining from, where are you listening from? My name is Olayinka Aremu, and I'm the founder and CEO of Adriel Care Link. Thank you, Bunchy. So, Adriel Care Link, we are very new, I would say, startup organization. And what we are focused on, we created an integrated care platform in form of a web app to connect older people and their families to trusted caregivers across the globe. Particularly, we kick off in Nigeria, Africa, but the vision is to expand it across the globe. Basically, it's just to see how we can connect older people using digital enabled platform to connect them to trusted caregivers, verified caregivers, in a form of preventative way. We want to prevent them from getting sick. We want to prevent them from getting hospitalized often. We want to prevent mortality and morbidity as much as possible and promote early identification of any, deviation from normal health, from good health, so that they can be managed on time. So that's what Adria Care Link is all about. At the moment, we are kind of rounding up on the web app development, and we hope to launch next month. So we want to continue to create an awareness about everything care of the other person, everything aging well, healthy aging, and how we can look after older people. So you're welcome if you have an older parent or you have an older person that you care about. This webinar is definitely for you. Okay, for those in the webinar, can you just let us know where you're joining from? And I'm also live on TikTok as well, so if you just let me know where you're joining from, and we're going to begin shortly. So I've introduced myself, but I also have a group of team as well working with me, both in Africa, in Nigeria, and also in Ireland. And I want to use the opportunity to say thank you to them. So I'm just going to go straight away to the webinar purpose. So the aim, first of all, is to shine a light on the often overlooked needs of older parents, especially in Africa. Now, I'm focusing on Africa because I live here in Ireland. I worked over in the last 8 years within the Irish healthcare system. And even though there's still some, they still need to do more in the health sector, but I would say relatively, the health system is focused on has a lot of resources that are supporting the care of the other person. So what we are doing now in Agewell is to focus on where the need is greatest, which is Africa. Research has shown that majority of older people in Africa are often neglected. They're the most neglected population, which is really, really sad. Thinking of, they have put in all their efforts, they have put in a lot, all their life into grooming the young ones, and when they needed us the most, we are failing them. So this webinar is to shine that light on that overlooked needs of other persons in Africa, and I would say globally, because the care can never be enough. We have to keep improving on care. So this webinar also hope to bridge the gap between cultural respect and practical care. Let's see how can we bridge that gap. How can we share global best practice in caring for older people? I'll be sharing some insight from my experience here in Ireland, in Europe, and in generally diaspora. What can we take home? And also provide actionable tools for families, communities, and professionals. So if you're a caregiver here, this will be very beneficial to you. And hopefully we can spark a movement to change the narrative from neglect to dignity for these older people. So why this conversation matters? And I'm going to ask a question. Just you can answer that in the chat box there. How are you caring for your older parents? Yeah. But actually, you have an older parent, either parents or, both of them or a single of them, or you have somebody that is old enough, to be a parent that you're looking after. First of all, if you have one, you can use the, raise and button or the thumbs up and just give a like there or something just to keep that conversation going. Now, while you're doing that, I want you to imagine this. I'm going to share like a real life scenario without mentioning any name. There's a 72-year-old woman in Nigeria, for instance, and she begins forgetting her medication. She's chronic diabetes for a long time, so she's been managing that. But the son who lives abroad notices only during a holiday visit. She has lost weight, she has missed her appointment, and she's overwhelmed. But she never asks for help. So there's no one's fault. If you look at it, this is no one's fault, but it's everyone's concern. Now think of it as somebody close to you that you realize, this older person just suddenly forgetting things. It is possible, it is generally inclined that you say that, oh, it's old age. Forgetfulness it's not related to old age. It is ill health, and that needs to be addressed. It could be a symptom of something that could be worse, or something that could actually be addressed quickly and then it's resolved. So this is a scenario, this is a very common one, and there are several similar scenarios like that of older people who are either struggling with their medication, struggling with their blood pressure, struggling with an aspect of their health, frequent falls in the homes, and so on and so forth. So how do we look after this category of people? Other people are aging in silence, right? But their dignity is at risk. We've seen a lot of situations where, you know, other people will be pushed aside because, oh, you're old, you're afraid, and they will not be looked after. This needs to change. So just to give you an African context, aging in a space of neglect. Yes, I come from Nigeria, one of the fastest growing aging population, but least prepared system is Africa. Yes, that's one of the fastest growing aging population, but the least prepared system is in Africa. Look around you. What are the facilities, that are in place in your locality to care for older people? What are the facilities? The road network, are they, friendly to the older people? The hospitals, are they friendly to the older people? The shopping malls, the groceries, are they older people friendly? Are they, aging friendly? We need to think about that. So in that space, we know that we say, oh, we respect your older persons or respect the old, but do we really respect them? If we respect them, we will show them dignity and we will show them care. So in these aspects, we are practical failure. So we've been failing on this aspect, especially in Africa. Thinking about that again, we see that most care is informal in Africa. I have an older parent, my mom. At the moment, we are struggling to get a stable caregiver for her, and over the years, we've been relying on families, we've been relying on maybe some distant relatives, just to come look after her, or even get some informal caregiver. Yes, and we need to talk about that as well. So most of the time, care is informal, and they are not reliable and they are not sustainable. This needs to change. And most times as well, these caregivers are not supported, they are not properly trained, they don't even know how to go about things. So they provide whatever care they could, uh, there are evidences or there are situations of abuse, both physical abuse of the other persons, financial abuse, emotional abuse, and also just because this care is not properly standardized or monitored and is not sustainable. Right. Still talking about the African context, most other people suffer from chronic illnesses, right? If they are not with high blood pressure or diabetes, they will have, some of them will come down with stroke, some of them will come with several illnesses, right? Some of them will have some disability, and other people also suffer from social isolation, and these are very common. Again, like I said, WHO has, has mentioned, as references and say older persons in Africa are the most neglected population globally. That needs to change. So now let's check in some learnings globally. What is working globally in terms of, especially inside from Ireland? So over here, there are community-based models like home care. So home care is standardized here. So we have different agencies that train or employ caregivers, trained caregivers. They have their certification. They've gone through some training. I'm very sure you must have had care jobs. So they're care jobs because the other people are a lot, they constitute majority of the population requiring care. So there's home care agencies that supplies caregivers or carers to the homes of older people to look after them, to assist them with activities of daily living, including washing. Some of them require, just personal hygiene. Some of them require grocery shopping. Some of them require, even just companionship and so many other needs, right? Toileting and so on. Even some of them, maybe they have their medical appointments, you have a carer going with them and all of that. So there's a community-based model that works in this part of the world. There are community nurses as well. There are public health nurses. All of these are they are in place to support the care of the other person. Apart from this, there are carer support. So the carers are supported, they are paid, well regulated. Like I said, they have to be certified, they have to be GADA vetted. We call it police certified. They do police clearance for them. They have all the trainings, they are paid. There is a standard. I think over here, the least person that will be paid, or the least entry level for a carer will be maybe 10 euros or 11 euros. And in some places, it could go as much as 18 euros per hour. You can do the calculation, right? So the carers are supported, right? There's respite care as well. Respite care in a situation whereby you just need like 2 weeks of care. You have parents that you are traveling, you could bring them to a respite home just for a few, maybe a week or so, just short period, temporary period, and then they return back to their home. That's respite care. And there are a lot of elderly friendly services. Like I said, there are like home shared, men shared, women shared, looking after the older people alone. Um, Enable Island, there's so many services and organizations looking after the older persons, and they provide support for them. I remember during COVID, there were organizations that were bringing home food to the home, Meals on Wheels, and so many like that. Now, the cities are age friendly. That means in terms of accessibility, in terms of public transport, housing, they are age friendly. The government sometimes just focus on building housing units just for the older people. In terms of policies and regulation, like I said, the caregivers are trained. There are safeguarding structures to protect the older people. Talking about dignity, it is at the core. Older people are seen, they are heard, they are planned for. So why can't we do the same in Africa? So we don't need to copy the West, but we can adapt what works and make it fit for our culture. Right now, this webinar is just 30 minutes, so I'm just going to go straight to how to care, and I'll be sharing 3 steps, 3 broad steps on how to care for your older parents or loved ones. There are three R's. The step one is recognize. First of all, you need to observe and understand their needs. We need to be very empathetic. We need to pay attention to them. Observe, understand their needs. Look out for missed medications. Look out for poor nutrition. Are they being forgetful? Are they confused? Do they have poor hygiene? Do you think they feel isolated or lonely? Are they sad? We need to look out for this. So recognition of any deviation in health is very important when you're looking after, when you're caring for your older parents. Now, this really, for me, became so much reality um, when my mom came to Ireland to visit for the first time. I saw there was a huge, after almost 8 years of living home, she wasn't the same any longer. She wasn't the same active, agile, strong woman I used to know. There was so much different, and I struggled to even adjust to believe that in the first place. It took time, right? And then you now see that this person that has been your mother, you have to now care for them, you have to now pamper them at the same time. So we really need to be observant. We really need to listen to them and not say, oh, but you should know, but you should know. We need to be empathetic when we're looking after our older persons. So that's the first one, recognize. I love you to share any insights you have as well when it comes to caring for our older persons. So what else do we have to recognize? What else do we have to observe? You look like from head to toe, so there's what we call comprehensive geriatric assessments here in the care of the other person. You might not be able to do that as an individual, but definitely you can get that done by an healthcare provider or in the hospital or by a nurse or by their doctor to do a comprehensive need assessment for them from head to toe to see if there's been any deviation from normal. Right, so very important to recognize. So how do you take action in this regard to recognize? Either through weekly phone, video check-ins if you are not living with them. If you are living with them individually, do that one-on-one or get somebody to do that. Or like I said, get a doctor or a nurse to assess them. Ask direct questions. Don't say, are you okay? Most of them will say yes. Don't just say, are you okay? Ask, did you eat today? What did you eat today? Did you go on a walk today? How is your leg? Ask direct questions. These are the ways we can get, responses and, from them. You might need to involve community members also who can also observe, ask people, how is my mom doing? Ask them these questions. So one of the top skill that I would say is use a basic observation checklist for families. And for everyone who have attended this webinar, or if you're joining, you could just email us. You will receive a prepared a care planning toolkit or checklist that you can use just to monitor and manage your older persons. Now, step two of that is respond. Now, step one, what is step one? Anyone, what is step one? You can put in the chat box. What is step one when it comes to the steps to care for your older parents? Step one, I've said it already. Put it in the chat box if you remember. Step one is recognize. So step two is respond. Now, it's not just enough for you to observe, you need to respond, and that you need to respond promptly. So one thing that I've realized that, especially within the African context, we do not provide responsive care to other people. We are more often reactive, not proactive. It is when they now get sick or when they are now really, really depreciating or deteriorating, that's when we respond. We shouldn't be. So we need to take respectful and practical actions in key areas of their health. Yeah. Welcome. We're talking about caring for your older loved ones, right? Caring for your older loved ones or parents. Now, step two, like I'm talking about, is respond. it needs to be respectful, and it needs to be prompt. Now, in terms of their health, are they on any medication? If they're, most of that people, especially those with chronic illness, we have polypharmacy. That means they will have more than one, more than five medications, more than two medications. They have so many medications. So you might want to check their medication box or their pill box to be sure they are not using too much, right? And this needs to be monitored. Now, I have an example. I'm not going to mention name that the way they just buy different things. They buy concussion, anything available. Somebody is using it, they buy. Somebody is using it, they buy. You need to check this. I was very, very strict with my mom about that. As a matter of fact, when she came to visit, what I did was I audit a medication bag. She has a bag for medication. I had to do an audit. I had to take out anyone that is not prescribed, that I know that is not prescribed. I had to take them out and trash them. Right, so we really need to be careful about that as well. Now, sometimes they might need reminders, and this is where caregiver comes in. If you feel that your parent is forgetting something or is being forgetful of their medications, you might need to get a caregiver that could remind them, like a medication reminder, maybe in form of journal or jotter or diary as well, or even digital reminder. There are a lot of digital technology now, tools that that can serve as reminders for them. Scheduled checkups. Do they have scheduled checkups? You need to also check so that they don't miss any of their checkups or appointments. Now, in terms of home safety, remember that older people, they are very, very, they're so much at risk of fall because of how tender their bones, the fragility of their bone, weakness of their bone. So they are very, very prone to falling. So what you want to do, you want to remove any trip hazard, anything in the home environment that could cause them to fall. It could require you rearranging the home front. If they're living upstairs, you might want to consider bringing them downstairs, and adapt the home to really be more safe for them to prevent fall. You might need to install some good lighting, in the house as well, making sure that the floor is not, slippery. You want to change tiles, you want to change anything. So all of this needs to be done to ensure home safety, right? Nutrition wise, if you observe that your older persons, maybe they're not eating well or they're losing weight unnecessarily, you might want to check their schedule of eating. Are they eating to time and all of that? And also in line with that is hydration. Other persons need to be able to drink. They need to be well hydrated, right? So those are the other things that you need to do. And if you notice any deviation, part of the way you can respond as well is what? Get them checked. Get them checked, get them to the hospital, not to a chemist. No, because I know we do this, not to a chemist, not call a quack or anybody. Get them checked in an appropriate hospital. Now, in terms of connection, so you remember I talk about social isolation. It is possible because other people, as they go, they lose their friends, right? They lose their friends, they lose people close to them, their children travel, go other places. So they tend to experience that social isolation. One of the things we can do is frequent setup, WhatsApp call, voice call routines. If you have siblings, you can schedule the calls. This person is calling in the morning just to keep tab and to encourage them to socialize as well. Connect them with existing community services that are available for older people. If they are religious, they should go to church, they should go to mosque, they should engage. It's very important that other people get engaged. Encourage intergenerational conversation. Ask them about when they were young, when you were young, and things like that. So it brings memories and it helps them to stay active as well. Now, another basic thing that is very important when it comes to responding is documentation. And now this is not really common. And one thing I've always emphasized is if you have an older parent, encourage, and they're learning, or even if there's somebody around, encourage them to write how they feel. If they have medication, write it out for them. Let them know the names of the medication. One thing that is, I know it's very, very absurd, and I really frown at that is most hospitals, they don't even write the name of medication. They don't write the name of medication, or they will just give it to them. I don't know why. And sometimes even my mom would say, I'll say, what medication? She doesn't know, right? She doesn't know. I was like, why? So we need to be able to help them to recognize the medications that they use if they're on any medication as well. Organize their ID, their health card, if emergency information, everything that is needed for them in case of emergency. So everything can be provided at once. So remember that care is not always physical, it's also emotional, it is spiritual, and it is social, just so we know. Now, what's the second R? I'm going to the third step, which is reinforce. If you can put in the chat box the second step that I just mentioned. So the first step is what? Recognize. And the second step is what? Anyone? Respond. So recognize, first step, second step, respond, and the third step is reinforce. So it's important that we build a sustainable care circle. Reinforcement means, there are things that we need to constantly remind ourselves as family, as group, assign family roles. Who is looking after this? Who is doing this for your mom? Who is doing this for your dad? You know, there needs to be some family care plan. And this is one thing that we are very, very passionate about. And it's one of I'll say our core value in Age Well is individualized care plan. Because we believe that every person, every other person, they are unique. Even if they have the same diagnosis, they are still unique. So we help in conjunction with the other person and their family to create an individualized, person-centered care plan for them, right? So once you have a care plan, you can follow through. For instance, a common care plan could be maybe for somebody who is at risk of fall, you set up a care plan and make sure that they have a call, maybe something to press, we say call bell here, but if it's the home, you can actually still get a call bell for them, making sure that the mattress is at the lowest level, right? Making sure that there are no clusters around the house. So we set that up for them. In terms of those who are in the diaspora, which I believe most of us here might be in the diaspora, don't just send money. You need to send care instructions. Now, we're very fond to say, oh, I've sent money home, but you also need to send care instructions. And this could be in terms of you hiring a trained caregiver to look after your parents, right? If it requires a living, get them a living caregiver. If it requires maybe a monthly check, get them one. So don't just send money, send care instructions, follow up with their care. Hire or support local help as well for your older parents. And some of them might even need other things apart from their health need. It could be domestic help, you know, it could be a driver. Today, I just share one of our clients desperately in need of a carer, of a driver and a caregiver, right? So all of these things need to be put in place. Also in the community, we encourage and we will be training. Come November, we plan to roll out a training program for caregivers, to people to be professional caregivers. We want to abolish, or we want to, as much as possible, get rid of OMOD, or as they call it in Nigeria, housemaid. So even their housemaid, they have to be properly trained. So if you are interested, please continue to link up with us or follow us. You're going to get more information about that when the time comes. So training volunteers, training people in the local community to be able to provide care for the older people. Um, if we look at it, we're all going to grow old, right? Is there anybody here that does not want to grow old? So whatever thing that we do now, it's just like we are investing into our own future as well, right? And in terms of community-based help, like I've mentioned. So I know in Africa now, the concept of nursing home is beginning to come on board. People are now embracing it, but it's still not yet there. So these are conversations that we need to have. Um, Now that with the increased Japa syndrome, you know, even the children are relocating, the 5-in-1 is relocating. Who will be caring for these older people who does not have that opportunity to relocate? So there's where we need to start considering, will this, will my parents or my older loved ones need a nursing home? Are there ones available? What do I need to know before I think that we should have a webinar like that. What do I need to know before, or if I should bring my mom to a nursing home, or you want to have a home care. Home care meaning that they are staying in their home, they are looked after in their own home. So remember, everything we are talking about is not when they are when they are critically ill. If another person is critically ill, please seek medical help. Take them to the hospital, right? But what we are promoting at AgeWell, we're promoting more of preventative care, early identification of any deviation from normal, right? So then the other thing about reinforcement now comes to policy and advocacy. I was really glad when I saw that in Nigeria. I think it was early last year or late 2024, the National Senior Citizen Center, I hope I got that right, or is it the Nigerian Senior Citizen Center, was established, and now there are policies. They're trying to drive some policies when it comes to the care of other persons. And I believe that this gradually will go around in Africa. So we need to start pushing for those national aging strategies, safeguarding policies, and all of that when it comes to the care of other person. And most importantly, if there is any service that will be developed, it needs to be inclusive of the older people themselves. So there's this saying that is common here, that nothing about us without us. So we cannot be designing or developing programs without the older person's, inputs as well. We need to get them involved in their own care. Very important. So I'm just going to wrap up before I take questions, what AgeWell CareLink stands for. Again, we are here to raise awareness about the importance of the care of the older person. We are here to provide you tools and resources that work. When I say work, tools that work, that we have seen work and that we are adapting and adopting as well when it comes to our services. We are here to also build a network of carers, of professionals and families that are passionate about looking after the older people. Talking about building network, in the link for those on Zoom, you can find the link. We have created a WhatsApp group called AgeWell Community, where we'll be sharing insights on how you can take care of your older persons. Either you're an older person yourself or you're a family or caregiver, you can join this group. So can I get my team to share the link? We can also share the link for those on TikTok Live. Kemi, if you can share the link in there so that they can join the WhatsApp group. As well, we have started onboarding. So if you're a caregiver, an healthcare professional, either a nurse, a doctor, physiotherapist from any part of the world, but most importantly, in Lagos, Nigeria, or in Ondo State, Nigeria, we would like you to come on board on our web app. Come aboard on our web app because we want to make sure that the other people in that region can easily access trusted caregivers. If you are an older person yourself or your family or caregiver, you can also come on board. We have a link there. Kemi, if you can share the link, or Jenny, share the link. just join our waiting list, and we have started onboarding as well. But if you have any, once we have any new services and all of that, you'll be the first to know about that. Now, I'm going to be wrapping up to say it's very important that we empower our African community. Thank you so much, Aluadami, for sending the badge. Thank you. It's very important that we empower African communities to care intentionally for our older people and not just reactively. Not wait till they get sick. Don't wait till they call you that, oh, my eye is paining me or whatever. Let us be very proactive in their care because aging well starts with caring well and it also starts with living well. So how can we help them live well? How can we help them make, positive decisions about their health? This is very, very important. So please, we are on YouTube. We have YouTube now. We'll be sharing video tips on how you can age well, on how your older person can age well, on how you can care for your older person as well. Just short video tips. So follow us on YouTube, Age Well Care Link, and subscribe. Make sure you subscribe and you click on the notification button, as they say. And my team, they're ready and going to be loading us up with educative videos and content as well. So again, I've said we are on Instagram, Adriel Kerling. We are on Facebook, Adriel Kerling. We are on LinkedIn, Adriel Kerling. YouTube, TikTok, and our WhatsApp group and channel is also open. So follow us, join the community. If you have any specific question, ask in the community. We will be there to answer you. Like I said again, we have developed an integrated tech-enabled care app that will connect your older persons to trusted caregiver. Our focus is case management. Our focus is preventative care, not reactive care. It's a proactive care, it's a responsive care for them, making sure that they get every care that they deserve and they desire, including domestic help, including maybe basic service like they just need a driver or they need somebody to transport them or they need a medical concierge. So our team is building up. We have a pool of care providers, both, like I said, nurses, doctors, physio, dietitian, and all of that, as well as other professionals to care for your older person. I believe that we have questions. If you have any question, you can shoot, you can type it in there. I'm going to read it out. We'd like you to do something for us. Please share what you have learned today. Talk about Adriel Kelling to somebody or share it on your timeline. If you are taking a screenshot while you are here, just share it and make sure you tag us. Watch out for our follow-up event. We do have a big announcement coming soon, please. So watch out for that. Remember, we cannot change the system overnight, especially in Africa, but we can change how we care today. For everyone who have joined this webinar, there will be a feedback form. Hemi, can you share the feedback form just to tell us what you have learned today? What would you like us to share next? We'll be having this webinar monthly, and you're not going to be seeing my face alone. You're going to be seeing experts across the globe coming to share insights and knowledge about how we can age well and how we can get our older persons to age well and live well as well. So we have completed that feedback. You're going to be receiving a free care plan toolkit and checklist, a free care checklist or care plan toolkit to help you, the signs you have to watch for, how you can track their medication, home safety guide, and so on. All of these in one download, and it is free just as soon as you complete the evaluation form. So thank you very much. I hope that you have learned one thing or the other in this webinar. I will take questions if there are any. Thank you. Any question? Okay, thank you. I'll just stay here for, we still have about 15, 17 minutes here. So if you have questions. Okay, I have a question here that says, why is it important to start planning care early before crisis hits? Well, the truth, like I've mentioned, it is better to be proactive rather than reactive. And one of the things I even want to mention about how to start care planning earlier. Okay, I'll take that question. So, how to start care planning earlier is that before a crisis often leads to, a crisis we often leads to rushed emotional decisions that is not planned for. So when you plan ahead, you give time to involve the other person themselves. You give time to allocate responsibility, right? You give time to also organize yourself as individuals, organize the family. You give time to prepare finances and avoid burnout for carers. So there are if you look at this older people, especially those in Africa, most of them are dependent on their on their children, for finance or their gratuity or their pension, which we know that sometimes they are not even paid. So this is why you need to plan early. And one of the things I want to say as well about that planning is what we call here advanced care planning. Will, writing a will, talking about their end of life care. So you don't have to wait till you are sick to start talking about how people should care for you in your vulnerable states. So these are the conversations we need to encourage our parents to start talking about, right? If you're weak, because definitely it's going to happen one day, how would you like to be cared for? Where would you like to be buried? Thank you. Thank you for the gift. Where would you like to be buried? What kind of, people talk as far as even talking about the kind of clothes they like to wear when it comes to decision making about their health. So we need to start this conversation. Thank you. We need to start this conversation. We don't talk about this in Africa. As Africans, we don't want to talk about will. We don't want to talk about it. They are very important. Far beyond the will, it's also about how to care for them in their vulnerable states, right? Are there people that want to be around them when they are weak and all of that? We need to start having this conversation. Do you have to start saving up? Over here, I find it very interesting that people save up for their funeral. They don't wait for their family. They don't wait for their children. They save up because they don't want to be a burden on anyone. And I think that's really fantastic. They have their retirement plan, they have their funeral, they start saving, there, which is very brilliant. So preparing finances, avoid burnout for carers, avoid burnout for families as well. So, which is right. So I'm going to ask that question from, this question is from TikTok now. How does healthcare provider work with Adriel? So thank you very much for that question. So as healthcare provider, you can go on an app. Once it's live, we're going to share it, but you can use the link that has been shared. Kemi, can you share the link for onboarding for care providers? So first of all, just get on on our waiting list that you are available to care for the older people in different capacity. If you're a nurse, a doctor, like I said, a physio, a dietitian, a mental health practitioner, a counselor, whatever specialty. If you know that you have services that will benefit older people, then you can come on board. You don't have to be physically present, but of course, based on our care need assessment, we will determine if our older person need a physical care or physical consult or interventions. Otherwise, you can join from any part of the world. So what it requires is just for you to get in your details, will be your credentials, just to make sure we want to make sure that they are vetted healthcare professionals. They are qualified, so we will be doing all the vetting, and it also includes the police check and all of that as well, making sure that your qualifications are actually, you know, uh, good. They're actually right. They're actually real credentials, are not borrowed and not fake. So we're going to be doing all those verification. And once you're being verified as as an healthcare provider, then your details, your profile will be active on our platform. So what happens is any older person or their family could come in and book you for their care. So let me start first of all, as an older person, that the client comes in on the system, they sign up, we will do the free care need assessment. Yes, so we'll be offering free care need assessment for every older person that signs up. So once we have the care need assessment, we'll be able to generate their care plan. And we're also incorporating AI as well to make it very efficient and fast as well. Our AI will be trained. We have, trained properly to be able to provide the correct person-centered care plan. So the care plan will recommend the kind of services they need. For instance, for an older person who is diabetic or managing diabetics and all of that, one of the recommendation could be to monitor the blood sugar, daily and all of that. It could also be to see a nutritionist. So if we have a nutritionist on our app, for instance, we will flag that to that nutritionist, and you can book the client to be able to book the nutritionist directly. So how it works is that the client pays through our app and we pay the care provider. So when we are sure that the care that has been requested has been provided, then AgeWell will pay the care provider. And you can save your money there. You have your wallet. The healthcare provider, you can see a track of all the clients that you have assessed. You can see a track of how much you're making. So it's also a way to have extra income for, healthcare provider. Extra income, just using the app. We want to provide, we will have telemedicine, virtual consultation, and all of that available. So I hope I answered that question. So this is Adriel Care Link. I'm just using my own TikTok, Caroline Karim, but please follow us, Adriel Care Link. We are also on TikTok. Can somebody tag Adriel Care Link there in the chat so that you can follow us on TikTok as well? Okay, do we have any other question? So we are going to be having several training, like I've mentioned there. We're going to be organizing trainings for the older people themselves so that they can get how to use the app. It's very straightforward, very easy. They have their own dashboard. So thank you so much for the gift. Thank you. So they have their own dashboard, and the care provider also have their own dashboard. So they can book appointments, they can attend appointments live through telemedicine, and so on and so forth. So it's a very, very brilliant service and app, and we hope that later on we'll be able to transform it into a mobile app that they can actually access, even though they can still access it via the mobile. Please keep an eye when we finally launch, so that you can be the first to make use of Adriel Care Link. Remember, like I've always said, we want to connect other people. We want to keep them home, not hospital. We want to prevent deterioration of health, for these other people. We want to be able to provide responsive care for them where they are comfortable. All right. Any other question? Thank you, everyone. Yeah. Okay, there's a question here. How can those of us in the diaspora support aging parents back home effectively? Okay, I think I've mentioned some of this, but I'll just recap again. Regular check-ins. So regular check-ins on them. If you are not there in person, you need to get somebody there in person, like a family or somebody to check in on them. And some people will say, oh, my parents, they are still active, they are okay, they are independent. Yes, but they still need to be checked. Then you need to have a clear care plan for them, trusted local contacts, you know, and even small, like I said, don't just send money, send care. Send care instructions. Don't wait for December visits before you send money to them or before you care for them. Stay involved all through the year and get them on board. This is the trick now, and this is the magic that will take care of everything. Get them onboarded on Adriel CareLink. Yes, we are starting. Yes, somebody said we are starting in Nigeria. Specifically, we're going to be starting in Lagos and in Ondo states. But that doesn't mean that we cannot service other areas. So if you are in any part of Nigeria as well, if you want to onboard your parents or your older ones, you can still onboard them. Yes, I'll leave a link in my bio as well, or you can DM me if you have any specific question for this. Is there a way to monitor care from abroad? Yes, I love that question. Is there a way to monitor? Yes, there is a way to monitor care. So if you are the caregiver, like the next of kin, or you're the child, you have access to, once we already have you on our system that you are the designated person, care personnel or so, you have access to their care plan. You have access to the care service that have been rendered. You can request for their medical, I'll say their care reports, because we are not providing treatment. We are not providing like medical treatment. What we are providing is care. We are linking them to available care providers, trusted care providers locally or even internationally in as the case may be. So you can have access, you can monitor their dashboard, you can monitor their care plan in that way. You can monitor through video calls and our app, of course, you can use it to monitor their health plan, their meal plan, their well-being, if this is already part of their care plan, right? So the most important thing is that we want to make sure that every care provided is personalized. Every care provided is well documented, right? So that's one thing. Okay. Somebody's asking when does a parent need more structured support? Yeah, so generally, according to definition, another person, if you're 65 or 60 years and above, so you need to have a plan in place for their care, even if they are independent. But especially when they start forgetting things, when they start forgetting their medication, when they fall often, when they are missing their meals, when they withdraw socially, or when they are visibly struggling with tasks, with all the activities of daily living. Even when they say, I'm fine, we need to observe closely. So at that point, then they need a more structural support, and you might need to get them a caregiver, right? Okay, we have 4 more minutes to go. Any other question on TikTok Live? So we're talking about caring for your older parents or loved ones. Okay, someone said, what if we can't afford professional care? All right. So now, one thing that we are very, very keen on at AgeWell is to make sure that the care, the service that we provide is very affordable. Very affordable, because we don't want it to be we don't want it to just be for some group of people or maybe just for the rich. We want it to be affordable. Remember that care doesn't always mean money. It can be time, it can be your presence, it can just be coordination, which is where Adriel steps in to help you coordinate the care for your loved one, right? So we will be already planning, to partner with some insurance company as well to make sure that the services are as affordable as possible. But just think of it, they always say that prevention is better and is cheaper than cure. So if you spend a reasonable amount of money to prevent them from getting sick, I think that is, reasonable and wise enough, right? Okay, I'll take one last question. How can older persons use a tech or a app? Wow, okay. You remember I said that we'll be training. So once a client is on board, we are going to train them and put them through how to. They are very simple tech, just like WhatsApp. If they use WhatsApp conveniently, then they're going to be able to use it. They can book, they can just click on it, there will be different um prompts if they want to talk to a doctor and all of that. And you can get somebody to help them if they can't as well. So we will provide the training for them. There'll be reminders, maybe for their medication, everything adapted. If they have quick questions, they could just even use a voice, do a record, the way you record on WhatsApp, they could just record whatever they want to say, and uh, our AI to be able to channel it properly to get them the care. Now, the one beautiful thing about Adriel is, like I think I've mentioned it, is that we have a case manager assigned to every client. So we're not just leaving them alone. So once they come on board, they are assigned a case manager. So the case manager will follow them through, will make sure that every care that they have been recommended is actually provided. Will help them, to make sure that they have the booking their, with their healthcare provider and all of that. So making sure that they receive the right care. Okay. All right. Do we have any other questions? So there's no other question. In the absence of no question, I would like to thank you all for joining our first webinar. Actually, this is our first webinar at Adriel Carelink, and we hope to continue to bring this to you monthly. Not just myself, we have various experts, specialists to talk about key topics on aging well, healthy aging, how we can provide quality care for our older people and other things. Okay, so don't forget to continue to follow us across all board. Join Adriel Carelink community on WhatsApp and also on LinkedIn. We will be opening up an Adriel community on Facebook as well. So once you see us, please, you already know where that's coming from. Adriel Carelink, care that connects. Thank you very much. Have a lovely evening. Bye.